This is a brief overview of collaborative learning in placement practice in the Southwest. So as you can see, we're going to have a look at CLIP in more detail and look at coaching skills and coaching in facilitating learning. So why are we introducing CLIP? This is a joint effort between the employers, the placement providers, and also the University of Plymouth, and the University of Plymouth supporting placement providers in implementing CLIP. The idea is it enhances the student's learning experience, and therefore supervision and mentoring becomes good quality mentoring. And the idea is that running CLIP actually recruits and retains people into nursing roles, and a good placement experience means a clinical area will recruit. To secure the future of the profession above and to secure good placements, it enhances everything. So this model was first introduced in Holland, and it's been widely implemented in the UK. And the aim is that students work together in groups or teams using coaching techniques with each other, being supervised by a registrant and support workers that also use coaching techniques. The registered nurse takes that step back, observing and using coaching techniques to facilitate learning and development, putting the student in front, letting the student learn by doing, organising their work, organising each other, and deciding on the patient care that's required. So students can reflect on what they're doing and relate it to current practice and the theoretical aspects of their course. They can build new skills and develop those, share their ideas and develop problem-solving skills. So essentially, students are allocated to a team on a daily basis, depending where they're working. Depends which part of the clinical area is going to be they're going to be working in, and the remainder of the ward functions as normal. Each student's allocated total responsibility of one or more patients, depending on their experience, and then they can access pathways in relation to their student's journey, and have a weekly reflective session led by their clinical manager. And it doesn't run during nights. Students will experience night, but CLIP doesn't work at night. A named mentor is allocated to each student, but they may not work that frequently with the student. They receive feedback from the RNs who are working with them, and those RNs feed back to the mentor on how the student's progressing. Mentors do set goals and meet for formative and summative assessments, as they always have done. And a mentor is available to the students 40% of their working week. So the benefits for the students is it rapidly develops their confidence and leadership skills as they coach each other as well as being coached themselves. They take greater responsibility for their learning and gain increased satisfaction. It enhances their thinking and confidence, and they develop clinical reasoning and decision-making skills, becoming second nature, which is expected of them when they become registrant practitioners. It will improve reflection skills, and research has shown that motivation and ability to resolve and deal with problems are higher than normal students coming up to graduation. It builds their self-esteem and increases their preparedness to take on that registered nurse role. Staff have that collegiate working across the whole team, and it improves self-worth and job satisfaction within staff, increases their motivation and their job, and improves recruitment retention to a clinical area. And all these things have been researched and evidence is available. So, traditional mentoring. Mentors direct student learning, the follow me kind of thing. See what I do, and then you can do, and I'll see what you do. Whereas coaching It's about listening, asking questions, stepping back and allowing students to learn by providing the care themselves and to make decisions about the care. So it lets the student direct their learning in the area and their needs and identify what they need to work on, and uses the whole ward and the whole team as their learning environment. All our students have been introduced to and prepared to peer coach and teach. Year 2 and 3 students are expected to keep logs and reflect and use as evidence of their competence. Mentors are being trained to develop coaching techniques, and we advocate the GROW model for our students and mentors. So the GROW model is a cycle. It's identifying and setting goals, ascertaining where you are now, what needs to be done. Encourage the selection and discussion about options that are required. And then the final decision is about what will need to be done. Using Q questions, students can coach each other. Mentors and registrant RNs and support workers can also coach using the Q questions. It can be applied to an hour, a day, a whole placement activities. You can set action plans and develop learning using this model. So when you're thinking about goals, it's like what needs to be done, what needs to be achieved. The reality is what's happening at the moment, and where you feel, what do you feel about it? How do you feel about being able to do something? Do you feel comfortable or not? And what could be getting in the way? What the barriers are, and who else it might affect. Thinking about options, are there alternatives? Where can you find out the information you need? And who could help you with these things? And then what do you really actually do? What needs to be put in place? So we're very good as nurses about giving advice. We like to come up with solutions for people, and that's all very well, but actually giving advice, you need to do this or you need to think about that, reduces the ownership. Whereas if you're getting students to think through for themselves what they need, what they can do, it enables them to be resourceful and also enables them to be able to make good choices. The other thing with advice giving is it prevents exploration, it prevents wider thinking and clinical decision making. So what sort of effective questions? Think about. Think about the questions that you use and how effective they could be. What is it you want to do? If you do that now, what would the implications be? What do you think the best thing is? Rather than those closed questions. So I'm asking you, what sort of practitioners do we want to develop? We want people to be challenged. We want people to be able to work things out themselves. We want people to build their confidence, and we want to be able to give people feedback so that they can develop further. And it's really important, those with the growth mindset or people with fixed mindsets. What is it we're after? Feedback's really important. We talk about it a lot with students, we talk about it a lot with mentoring. It's really important for students to get feedback on how well they're doing and where they need to go, and agree in a plan feeding forward. So think about how you might manage the following. So a student asks advice. They've not received a report from a patient. They don't know that patient at all. And the patient asks them, can you take me to the toilet? So what would you ask? What is the goal? The ultimate goal. What are the time frames required? Where are you going to find the information that you need to know? What decisions are you going to make? And how are you going to put those into place and action them? Making choices, finding out the best way to get the information that's needed. Fairly straightforward. What about, I've been looking for somebody and can't find. Somebody's lost. How do you coach a student to be able to manage this? What are the options? What are the choices? What needs to be done? What's important? How are you going to encourage that thinking? So, a patient's got a fractured femur. How do you coach that? What sort of questions are you going to be asking to coach? What things do need to be done? How do you encourage them to sort the priorities out? The thinking about time. What needs to be done, really importantly? What can be discussed? You can still ask the questions, encourage the thinking and the decision making whilst the activities are being done. Somebody's collapsed. How do you coach someone through that? What's important? How can you reflect on what's going on? This is a good thing to do as a hypothetical question. What would you do if somebody collapsed? How would you manage that? What is the goal? What are the options? What the reality is and what needs to be done? Again, you can use those questions whilst action is taking place. Or you can reflect at the end on what could be done, what needed to be done. How could this be done differently? What do you think good priorities are in looking at these things? Maybe reflecting after the event is the right thing. What was the goal? What was the reality? What were the options? And what could you do if it happened again? Do have a look at this video. It shows mentors and students talking about their experiences using CLIP. So what did we find when we went and had a look at CLIP in action? We found some very enthusiastic students, some very highly motivated students, and also the person who was supervising them for the day, who was a preceptor, not long qualified themselves, but had chose to go and work in that clinical area because they did CLIP, because they felt it really helped them learn. Students were empowered, they were making decisions, they were considering options, they were supporting and coaching each other, working out how the day would run, who was going to do what was important, and supporting each other in the activities that they were doing. Thank you for listening to this short presentation. I hope it's given you a taster to have and a thirst to explore CLIP more.